Hi, my name is David Ecker. I'm a hospitalist at the University of Colorado Hospital, and I'm trained in internal medicine, caring for the acutely ill hospitalized patient. I'm also an assistant dean of medical education at the University of Colorado School of Medicine, and I direct the first year pre-clerkship curriculum. I'm grateful for the opportunity to introduce you to the exciting, experiential, integrated Trek curriculum that together our faculty, students, scientists, physicians, interprofessional healthcare colleagues, and community partners have designed for you to become transformative physician leaders committed to serve the profession, our patients, and society. The Trek curriculum is designed around a mountaineering theme, which hopefully makes sense as our campuses are nestled against the foothills of the Rocky Mountains and offer amazing opportunities to explore and discover on your path to becoming an outstanding physician. During the first year pre-clerkship curriculum, also known as the Plains, you will develop a strong foundation in the medical and clinical sciences, as well as gain an appreciation for the communities in which you will serve. The second year, the Foothills, is also considered a foundational year, during which all students will participate in longitudinal integrated clerkships. The final 2 years of the curriculum, Alpine and Summit, offer numerous opportunities to advance your knowledge and skills through individualized paths. Throughout the 4-year Trek curriculum, 3 curricular pillars, the basic medical sciences, the longitudinal clinical sciences, and health and society, which is much more than purely health system science, are interwoven and synergistic. Each pillar's content is developmentally scaffolded. All students receive the foundational curriculum during their pre-clerkship and clerkship year. All students receive the advanced curriculum after their core clinical experiences. And finally, students enter the individualized phase in their final years, which are designed to prepare students to meet their unique career goals. I also want to highlight the role that assessment and evaluation plays throughout all aspects of the curriculum. Assessment has been intentionally integrated in a multi-layered fashion, which provides students with the opportunity to receive frequent formative feedback to guide their development, and through summative assessments, ensures students are achieving appropriate milestones at each critical juncture of their journey. Of course, these data and our robust evaluation processes provide a firm foundation for our continuous quality improvement efforts. In just a few minutes, you'll hear more specifically how the 3 pillars are integrated within the pre-clerkship curriculum, and I want to highlight the guiding principles that steer our curriculum's design and delivery. Wherever possible, we strive to be evidence-based and apply the science of learning to maximize our students' outcomes, which is why integrating the learning and fostering a growth mindset play such prominent roles throughout the curriculum. You will also recognize our commitment to developing longitudinal relationships and providing students with authentic, patient-centered experiences right from the start of their first year. Now, let's take a deeper dive into the first-year curriculum, the Plains, during which you'll learn foundational concepts to prepare you for clerkships and beyond. The Plains is a 52-week curriculum that's organized around body systems. It's divided into 10 primary courses, which range from 3 to 6 weeks in length. Throughout each of the courses, you will engage in an integrated experiential curriculum, and you will routinely assess and receive feedback on your knowledge and skills to be sure you're learning foundational concepts as you prepare for clerkships. There are also 5 traverse weeks, which I'll talk about in a few minutes. So, what does the typical week look like for you during the first year? Well, when structuring the weekly calendar, we created as stable a calendar as possible, as we've heard from so many students that a predictable schedule facilitates not just work-life balance, but actually promotes work-life integration. Each week will begin with a chief concern presentation. The week's content is framed within the patient experience, during which all 3 pillars are woven. This not only stimulates students' curiosity about the week's content, but also provides an organizational strategy for which you can arrange your learning. The medical sciences begin the week and employ various formats. lectures, small and large group work, and team-based learning all around clinical cases. Our medical science pillar consists of 9 disciplines that are interwoven with one another throughout the pre-clerkship curriculum. Actually, each discipline is assigned a longitudinal content director who is responsible for the scaffolding and shepherding of content throughout the 4-year curriculum. I'll highlight that they, alongside our course directors, have been so thoughtful at surveying the overwhelming amount of information that medical students need to learn nowadays, and have divided that information in a logical way that's presented to you at the appropriate points in your career. In other words, content has not just been crammed into a single year. Rather, the content has been intentionally scaffolded for you to learn and experience at appropriate stages for your learning. Monday afternoons are dedicated to active learning rotational work, including anatomy lab, pathology lab, radiology, and ultrasound learning, just to name a few. The medical sciences continue Tuesday morning, after which half the class will participate in the clinical skills curriculum. The other half will participate Wednesday mornings. The clinical skills curriculum during the pre-clerkship year ensures our students learn and practice patient-centered communication, physical examination, and clinical reasoning skills via weekly simulation activities with standardized patients. For these weekly sessions, students work in stable small groups with a trained physician coach who's charged with developing their students' clinical skills over the entire year. The longitudinal relationships between students and their coach allows individualization of your learning and development. Additionally, beginning at week 6 of the year, students are matched with a physician preceptor, which enables you to take the skills you're learning out of the classroom and apply them into the clinical space to authentic patient care experiences. Students will spend a half day every month caring for patients with their preceptor's mentorship. Wednesday afternoon is reserved for additional small group work focused on foundational health and society content, which is more than just health system science, as I mentioned. This content is delivered in stable small groups with students' compass guide, a physician who assists students' longitudinal development as future physicians throughout the 4-year curriculum. The Health and Society curriculum prepares our physician graduates to be systems thinkers who will provide exemplary patient and family-centered care and promote health equity and population health through advocacy and leadership. As the week comes to a close, we've reserved Thursday afternoons for you to work in small groups again to synthesize, apply, and review the content of the week to additional case-based learning sessions. This positions you well for a low-stakes knowledge checkpoint at the end of the week. After sitting for the checkpoint, students will engage with some material that's exceedingly important and often difficult to test in VISTA sessions. For example, you may hear from patients with the conditions that you've learned throughout the week to better understand the impacts on their life. You may hear and participate in ethical debates, and you may learn and practice wellness and resilience strategies. The week ends with a facilitated review of the morning's checkpoint, which is designed to provide you with feedback of your understanding of all the week's material, and it will assist you in setting new learning goals moving forward. Each course ends with higher stakes summative assessments. The pre-clerkship curriculum is graded as pass-fail, which encourages students to work with one another in a collaborative environment to solidify foundational concepts essential for becoming outstanding clerkship students. And for those of you calculating, you can see that each week offers 2, if not 3 half days of unstructured time, during which you might study, hike, or grab a bite to eat with a friend. Scattered throughout the plains are traverse weeks, which are a type of intersession. These are 4-day work weeks during which students participate in additional knowledge and skills assessments, advance their professional development while reflecting on their journey, and engage in individualized activities that charge their batteries. The final portion of the plains I'll briefly describe is the Compass program. It's a four-year program designed to inspire and support students in maximizing their personal and professional potential. At its core are the aforementioned physician compass guides who work longitudinally with students as their coach, advisor, mentor, and dedicated teacher for small group sessions, including those Wednesday afternoons dedicated to health and society I mentioned earlier. Well, that was certainly a whirlwind tour of the first year pre-clerkship curriculum. It's a curriculum that consistently invites students to openly engage, actively learn, build longitudinal relationships, and self-assess throughout the year. It develops students' knowledge and skills to provide effective, equitable, patient-centered care throughout our shared values of leadership, curiosity, and commitment. We are excited for you to join us on this trek.